Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friend. Welcome to this week's episode of the Healing Pain Podcast, where we're discussing heart rate variability for mind-body health as well as athletic performance. Our expert guest this week is Professor Karen Mueller. Karen is a professor in the Department of Physical Therapy at Northern Arizona University and the author of the book Communication from the Inside Out: Strategies for the Engaged Professional. With a career-long interest in the promotion of mind-body health throughout the lifespan, she has published and presented in the areas of mindfulness and brain-based communication strategies to support optimal living. Karen's current research involves the study of compassion among healthcare students and burnout among physical therapy students. On today's episode, you'll learn all about the importance of measuring heart rate variability, how training heart rate variability can help improve athletic performance, and the importance of heart rate variability for both physical and mental well-being. And before we begin, I wanted to let you know that my newest book, called Radical Relief: A Guide to Overcome Chronic Pain, is available for pre-order on Amazon. Radical Relief is based on 3 science-backed methods, including pain neuroscience education, acceptance and commitment therapy, and mindfulness, a topic which we'll be discussing on today's episode. Radical Relief is perfect for practitioners who treat chronic pain or for people living with pain, and it's filled with brief exercises that use the power of the mind, as well as easy-to-read chapters with full-color illustrations. You can pre-order your copy today on Amazon. Okay, without further ado, let's meet Professor Karen Mueller and learn all about heart rate variability. Hi, Karen. Welcome to this week's episode of the Healing Pain Podcast. It's great to have you here.
Joe, great to be here. Thanks for having me.
Karen, I love looking through your research. For those who don't know, I read your entire bio in the beginning, but you've been a physical therapist, a practicing physical therapist for over 40 years.
Yes.
And probably about 30 of those years, you've been involved, of course, as a professor at a doctorate program of physical therapy. So you've got a vast range of knowledge and experience, seeing us go from like a bachelor's program to a master's, now to the DPT, and doing the amazing work that many physical therapists are doing, of course, in the United States of America and around the globe to help people. A lot of what you talk about revolves around communication. So helping physical therapists be effective communicators using principles of mindfulness as part of that. Mm-hmm. What led you to that discovery and to the interest with regard to communication?
Well, it's funny. I always like talking about this because I think it's really interesting to locate people's interest in their background. And so for me, I grew up in a family of psychiatrists. So I had a father who was a psychiatrist, an uncle who was a psychiatrist, and eventually my brother became one. And I just remember asking my dad, what do you talk about in your sessions? And of course, he kept patient confidentiality. But he said, what I find is that people are either unhappy in their relationships, and that's related to poor communication, or they're unhappy in their work. And in many of those cases, certainly, depression and some mental illness is a big factor. But underlying that is often a failure to communicate effectively. And that really struck me. And I would have become a psychiatrist myself, except I recognized fairly early in my life that I'm too extroverted to do that. And I don't think I can sit all day and listen to people. But I never lost my interest in connecting the mind to the body. And so my years of PT school are faded memories, except for a class that I had with the medical school at the University of Missouri, where I got my bachelor's degree. And we were lucky enough to have a couple of professors who taught the medical students. And one of the courses was human ecology. And he started talking about an evolving field called health and wellness. And I remember just looking up at him going, that is what I want to do. And so I think I have taken that interest into my profession, which after I graduated in 1979, I took my first position at Rehabilitation Institute of Chicago. And of course, when you're working with people your very age, I was 22. And so here are people my age who, but for the grace of God, were on the same street I was, but they got in the car accident. I didn't. So there was a lot of emotional adaptation to that, which really strengthened my interest in connecting with people deeply and meaningfully. I volunteered for the sexuality committee because, again, I saw that as an area where communication is not happening. So I did that as I worked at Rehabilitation Institute of Chicago. I eventually became their academic, director, what do you call it? Center coordinator for clinical education. And teaching was my other passion. And again, from my father, sneaking into his lectures on human sexuality in PT school was a highlight. So I think, I've taken the interest that my father instilled in me and have taken it through my career.
The beginning. And then when I think back to, even my experience as a physical therapist, so I was accepted into PT school in 1995. And to get into school, you had to have 2 psychology courses. You had to have, general psychology, abnormal psychology, and then psychology of the disabled. So those were kind of the 3 prerequisites at that time. But in PT school, there wasn't a tremendous amount with regard to the psychosocial variables like we have now in DPT programs. Right. Have you seen that evolution in your own?
Absolutely. Absolutely. And I was fortunate enough when I took the position at Northern Arizona University to be able to teach those classes, clinical communication and psychosocial elements of disability in particular. And I realized quickly there was no textbook. Carol Davis had a great one, and I will shout out to her for her patient-therapist interaction book. But I wanted to take her work and expand it to my own research. And what got me to write the textbook, Communication from the Inside Out, was my PhD research in work satisfaction among physical therapists. And I looked at how long did you leave the profession? How satisfied were you with the profession? And if you weren't satisfied, what was getting in the way? And what I found is that it was all communication. It was communication at the team level. It was communication at the intercollegiate level, working with colleagues. And it was your own attitude. So I developed a 3-level communication strategy: internal communication, which is what you tell yourself, which affects how you talk with others. And if you're not empowered in those dialogues, you're not going to move to the higher level, which is instrumental education, which is the teaching. So that's the model of my book. And I don't track its success that well, but I have been to meetings at APTA educational meetings where people have talked to me about the book. So I hope it's I hope it's been helpful. I had fun writing it.
In addition to the psychosocial variables, communication and mindfulness, you also have done some research with regard to heart rate variability. And I want to talk about the research. We have a great paper that you did. We'll talk about that a little bit in the episode here. But tell us first, to get everyone's kind of interest, what is heart rate variability?
Okay, so you do an EKG, right? And that tells you your heart rate. But what we're not able to pick up unless you have sophisticated instrumentation is the beat to beat interval between R's, and the EKG. And that varies by milliseconds, undetectable unless you're in a 12-lead EKG or use another form of instrumentation. And what's interesting is that the variability of that is a level of responsiveness within the central nervous system, particularly the parasympathetic nervous system. And so heart rate variability is really a measure of homeostasis. If you have low heart rate variability, we want low cholesterol, but we don't want low heart rate variability, because what that suggests is that you are stuck in a rigid pattern of lack of responsiveness. And what we're learning now with the research is that relates to a higher level of sympathetic drive. So if you think about being stressed all the time, your inability to return to a baseline is an evidence of a lack of flexibility within the parasympathetic nervous system. Okay. And so high heart rate variability means that you are able to put your parasympathetic nervous system online when you need to. And so I got really interested in that because part of my upbringing too, Joe, was learning how to meditate. Mm-hmm. So my father and I and my brother all took the early transcendental meditation. But I was interested, well, how do we know if it's working? I feel good, but how do we know? And so when I learned about heart rate variability, I was so interested because here is a really robust biomarker. And if you think about biomarkers that we use now, they usually involve a blood draw or they involve some other sophisticated instrumentation. And what we know now is that HRV can be measured on your smartphone. And so it can give you an indication of your homeostasis. And it may be able to do that before your body knows it. Or it can correlate if you're feeling cruddy, it gives you an explanation.
So that R interval is important
Yes.
for practitioners to look at. It's a measure of your parasympathetic nervous system response.
Yes.
And it's a biomarker that can be measured in a way that's non-invasive and you can just use it on your smartphone.
Correct.
I think all of that is so important, both for people who are interested in their health and wellness, as well as professionals. Because obviously what you're saying is there are ways as licensed health professionals, we can take that kind of basic cardiopulmonary knowledge that we all learned in physical therapy school, right? We all studied
Right.
that school, and start
Right.
to translate that to practice in a way that's beneficial for people with regard to modulating their sympathetic parasympathetic nervous system.
Absolutely. Absolutely. And so, Joe, so just to give you an idea of what you're actually reading. So how do we measure HRV? Well, there is a sophisticated logarithm, but it's based on the mean root square of successive differences, MRSSD, which is an element of, it's a logarithm related to a mean, if you will, of those R and R intervals. And then the logarithm converts it to a score between 1 and 100, basically. And so if you have high HRV, you're going to have a higher RMSSD, and it will come out as, depending on what instrument you're using, 1 to 10, 1 to 100. And so there's not a whole lot of research on what means are, but there are enough that you can kind of get a general idea of what you're trying to aim for. Higher is better.
That's easy.
But there are just some subtle changes related to age and gender too that are slightly different. But again, those are meaned.
With regard to just overall health and well-being, both physical well-being as well as emotional and mental well-being, heart rate variability is important for, let's say, what type of populations we might see in clinical practice and what type of conditions that people are looking to obviously overcome and mitigate.
I really think it has applicability to a wide number of populations. A big thing is athletic performance, avoiding overtraining, avoiding that non-functional overreach where you work a little bit harder in the hope of increasing your performance, but you go too far. A constantly dropped HRV will tell you you're getting into that danger zone. You should back off. And I'm an athlete, you probably are too. You know how it is. You just want to keep going. And you have those days where you work out against your better knowledge. And having that number in front of you can be helpful. So there's the athletic population. Chronic pain, we're learning more about what happens. You would imagine that people with chronic fatigue syndrome, we're starting to look at HRV in that population as well. And we're seeing similar things and what's interesting for that population is that they're often exhausted. And, then you can see changes in their baseline HRV trending downward.
Excellent. So you started to talk about elite athletes. And I know you did a paper. I want everyone to check out this paper. It's in the Journal of Cardiopulmonary Physical Therapy, 2019. It's called Heart Rate Variability Biofeedback, Improves Sport Performance in an Elite Female Athlete. So it's a great case study. I was just commenting to Karen before we started that there's a tremendous amount of not only useful back information here, but also useful information for people to use in clinical practice. But tell us why you decided to conduct this case report.
Well, I've been experimenting with HRV meditation myself. I'm always willing to try new things. So I had been using a application called Inner Balance from HeartMath. And so it is an app you download on your phone, Inner Balance, and then you attach an ear clip to your phone, and it uses a plethysmographic, I hope I can pronounce this, plethysmographic reading of your HRV on your ear, okay? And so it also, the program cues your breathing, because we know that we can activate our vagus nerve and our parasympathetic nervous system by slow breathing. We actually have a name for that called resonance frequency breathing, which is a breath rate of about 6 per minute. And so you can count 5 in, 5 out, but just to have the application was useful. So that was, I think this is really interesting. I would love to do a case study. And I had this student who was trying to improve her own athletic performance. And I asked her, would you be interested in doing this? And Laura was an elite athlete who barely missed the Olympics by 5 minutes. I mean, this is a really high-level athlete. Plus, she was a DPT student. And those of you who are new grads or in PT school, need I say more about the stress of PT school? And here she was trying to keep up her twice daily regimen. It seemed like a perfect opportunity to assess whether this could be helpful to her. And so we let her pick the parameters. What is it you want to measure? She said, I want to measure school stress. I want to measure my sense of subjective performance. Do I feel better working out? And do I have better post-workout energy? And so those are the 3 things we tracked. And what we did is she did 4 weeks of baseline where she did a regular workout. Are you with me? And just recorded her stress. So we had a spreadsheet where she recorded those 3 parameters. Then we took a week break. And then we did another 4 weeks of 15 minutes a day of the Inner Balance HRV meditation. And she chose to do it at night. It doesn't really matter when you do it. And we got some pretty interesting results out of this, okay? And so one thing we noticed, she increased her workout time. She didn't mean to do that. I mean, it wasn't the plan, but she had her post-workout stress drop significantly. Her median HRV went up significantly, okay? And she had more days of peak performance where she felt like this, I'm on, you know what I mean? And so she had twice as many subjective ratings of high morning readiness, okay? And the other thing I needed to add, how do we measure HRV with her? So she's doing the meditation, but we needed to measure her HRV. So we used an application that you could use in clinical practice called Elite HRV. So it involves a chest strap and a smartphone application, and it provides you a morning readiness score between 1 and 10, which is related again to that logarithm. So she rated her morning readiness, okay? And she did that through trial A and trial B. I'm sorry I left that out. So that we could compare her HRVs during the baseline and during her meditation. So the only thing that changed in the experimental part was her doing the meditation. Okay.
So the morning readiness piece, just tell me a little bit about that piece a little bit more. What does that really mean?
Well, again, it's a logarithm, and Elite HRV was developed by people who are very involved in athletic performance. So out of 1 to 10, 1 to 3 is considered low morning readiness. You probably should do something a little bit different, maybe relax, take a break. 4 to 6 is medium, go at your normal, don't go over it. 7 to 10 is high, go for it.
Excellent. So she's ready to start her day and potentially engage in more training.
Exactly.
Yeah.
Exactly. And I should say that you have to get an accurate HRV reading. The literature is pretty consistent in saying that you should do it supine first thing in the morning. Mm-hmm. So no coffee, get up, do that first. And then, so you've got your baseline for the day. And in order to really use it to titrate your training, it is recommended that you do that for 2 weeks so that you have a baseline. So we did it for 4.
Right. So you measure a baseline, you have your baseline, and then you can measure your morning readiness as you're using the app or using the training that you use in the study. And you mentioned that her heart rate variability increased, which is positive, yes, which means that she's more able to enter a parasympathetic response or a parasympathetic mode, which can be helpful for recovery with regard to physical activity.
Absolutely.
Right.
Yes. And so her ability to have a better sense of during workout energy, post-workout performance, and increase the amount of time. She was working out 638 minutes a week in trial A. It went up to 747 minutes a day. just because she felt good.
And that's pretty
So,
amazing,
I mean,
that alone and being in DPT school.
yes.
So you're already taking a subject who is under stress, especially somewhat psychological, emotional load, right, is high in DPT school. But
Yes.
proving with this app and with that heart rate variability and breathing intervention that wasn't necessarily a factor in her training.
Right.
Yeah.
Right. It's a, and I'm looking, what's interesting is that we found her school stress stayed pretty high, but everything else improved. And, but there's a caveat to that, because we did this in the spring when students are getting ready for a comprehensive exam. I mean, it's the most stressful time in PT school is the second year, right before you go on internships. Many people just decompensate. She stayed stable. So to me, that is a good outcome. But
yeah, I mean, the athletic part is, of course, fascinating to me. But as I'm reading the study, I was like, this has implications just for DPT students and other types of students who are under stress in general, which is important.
Absolutely. Yeah. Absolutely. I teach mindfulness to my students in my communication class because I see that as a critical internal communication skill. And I tell them about this instrumentation. A lot of them pick it up on their own. But, it's like, if you're really interested in seeing how this works, because there are always people who don't buy into it, this is really useful. So, yeah, I mean, wouldn't it be cool if we all kind of use that as our daily biomarker? Of course, we might use it to get out of work where we shouldn't. But it gives you guidelines, which I love, of days where you really can, go out there and, it's game day.
And just tell us what she had to do, because she was only involved in this for 15 minutes a day, 5 days a week, correct?
Right.
And just walk us through, like, piece by piece, what did she do to engage her heart rate variability?
Are you asking me specifically what activities she did, or I'm not sure.
So with regard to the breathing aspect of it, what did she have to do?
Okay, so what the app allows you to do is it provides a mandala that changes color or changes tone when your HRV gets higher or lower. So you can literally use the auditory signal while you are breathing. And ideally, with the heart mouth, what they believe, and I think there's truth to it, you breathe slowly and you also engage positive emotions. And we know there's a direct connection between the parasympathetic nervous system and positive emotion through the ventral vagus. And so what she told me she would do is she would sit up in her bed before she went to sleep, put the clip on her ear and breathe for 15 minutes. And that's how she did the meditation, listening to the tone. Whenever it goes, whenever you were getting an indication that it wasn't good, then you could breathe again or bring your attention back to positive emotion. So you always had an anchor to make it simpler.
So she engaged in the breathing exercise for 15 minutes, and there was some kind of positive reappraisal, if you will, that's part of that experience.
Yes, positive reappraisal. And what's interesting is there's been Barbara Fredrickson's work in positive psychology, another favorite area for me, that gratitude is one of the best emotions to focus on.
Yeah.
So just what you're thankful for.
What I love about this study is that it's quite simple.
It really is.
The analysis is not simple. You put a lot of work into the study design and the analysis, and obviously describing everything that is associated with heart rate variability. And that's the science part that you're brilliant at. But the actual intervention itself is quite simple. And you mentioned you mentioned you teach mindfulness to your students. Is that something we should adopt more in the world of physical therapy?
In my mind, absolutely. Absolutely. And I am a health coach too, Joe. And so I really believe that one of the elements of health, of course, I know this is stress. And so if I've got a patient with me who's really stressed, meditation can be so helpful. And I can give you a concrete example. I had a young patient with stroke who is recovering well, except for dynamic balance. And working with her, I began to notice how anxious she would get when she was confronted with a balance challenge. And I said, do you think perhaps it is your anxiety that's getting in the way? And she's like, absolutely, I'm so nervous. And so we started, and it's so low tech if you want it to be. I'm like, well, how would you want to practice using breathing to calm yourself so that maybe you can kind of attenuate some of that anxiety? And she was all over it. So we found a simple guided meditation on YouTube. So, and I tell my students, find something you like, find a voice you like. And so she did that, and it made a remarkable difference.
And that relates well to the research with regard to pain as well, because pain-related anxiety or fear associated with pain has a lot to do with how it impacts our physical function.
Absolutely. Absolutely. We have done, I haven't done as much work in chronic pain as you have, but what I have found is that not only is there a sense of pain, but there's almost a sense of aversion to that body part. Mm-hmm. And so it's just like, can you allow it? And so a lot of it is for physical therapists, it's the languaging we use. And so to say, you don't have to do anything but just notice and follow it. Where does it go? So you kind of engage their curiosity to make it more of if you can make it an adventure and get their head out of the pain part of it. I've played with that as well. Haven't studied it specifically, but absolutely could be useful.
Another part of your study, which I found refreshing, is that without saying it specifically, it really puts the mind and the body together in a way. So as physical therapists, we're not throwing the body out. We obviously study cardiopulmonary physical therapy. We understand the function of the cardiovascular system and how important the pulmonary system is. We understand the biomechanics behind sport. And then with that intervention and with the help of the app, it's really creating a body-mind continuum to help someone with, in this case, sport enhancement and sport performance. And in a lot of ways also with regard to stress, with regard to school and being able to handle a large load of work in DPT school.
Right.
Why in our profession do you think using the mind is still considered a radical idea?
Boy, I hope we're past that, Joe. But I think, when we started talking about soft science and hard science, I think that started the whole thing. And I certainly heard that in PT school, and perhaps you did too. And as a PT student, you're very concerned about the hard science because those are the grades are. But what I'm learning to call it is, let's not call it soft science or soft skills. Let's call it success skills. And let's talk about, and I engage my students in dialogue about who are the people you admired most in the profession? Are they the good communicators or are they the top clinicians? And, when they learn how important that is, I think, and of course now there's evidence, which there wasn't when I was in PT school. There is so much compelling evidence. I just gave a lecture on the impact of adverse childhood events. We did not know this. We did not know that the health issues of our patients and even ourselves are related to what we experienced as children. So as this science comes out, it becomes really hard to ignore that you have got to think about this, or you're not doing a good service to your patients.
So it's no longer an option at that point.
In my mind, it has never been an option.
Yeah.
As I was just seeing what my father dealt with. But I am so grateful that there is a community now of people who are looking into this and are sharing this information. I think this is what got me interested in pursuing health coaching. And I'm excited. This is another really interesting thing as we're getting more into that as physical therapists. I will come full circle, and that will be, truly the art of science or whatever, the art of caring and the science of healing, as we've always talked about.
Yeah, the cognitive change process is so important with regard to every population we see in physical therapy and physiotherapy across the globe. So it's really wonderful. Like I said before, it's great to see you put all this together in a nice case study. And of course, I think case studies are so useful for clinical practice. Therapists can read this and say, hey, I have a similar patient to this I can try this with. Or maybe a patient that is not exactly like this, but I think this might work, and they can apply that. So really great.
Yeah, that's exactly what I wanted to do with this.
Yeah.
And to also assure them, you'll do no harm. You should do no harm, right? And if somebody is deeply traumatized And, we're not trying to get into the realm, but I think that's another concern. Are we going to start becoming counselors? And I don't think, I think we do a lot of supporting and a lot of listening. And through that astute support and listening, we know when it's time to refer. Mm-hmm. So we can do more good by connecting our patients. We can be better interprofessional collaborators if we listen to our patients.
Great, Karen. It's been great speaking with you today. How can people learn more about your work and your information, and how can they follow you?
Oh, thanks. Well, I am at Karen.Mueller at nau.edu. I often get emails after I give talks. I am in the Well Coaches site of certified coaches. Those, I'm not really a social media this is where I kind of date myself. I speak often at APTA conferences. Probably every other year I give a talk at APTA. And the other area that I've been involved in, because it's such a deep area of connection, is end-of-life care. So I am on the advisory board for the Hospice and Palliative Care Special Interest Group through the Academy of Oncology. And we meet every year at CSM.
Great. So we'll include all those links on the show notes at the Integrative Pain Science Institute with regard to Professor Karen Mueller's podcast today. You can, of course, find her by going to the website. You can look up the physical therapy faculty and staff at Northern Arizona University. Her bio is there, as well as information to contact her. I want to thank Professor Mueller for joining us today on the Healing Pain Podcast. Make sure to share this episode out with your friends, family, and colleagues who are interested in mindfulness and heart rate variability, by feedback on how it relates to sports performance, as well as health and wellness. I'm Dr. Joe Tatta, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.